Hi, I'm Dr. Noelle Lucas, and I'm from Blue Oasis Pet Hospital, here to take some questions about your dog's dermatology issues or skin diseases. And I have an assistant that's going to ask me some questions about dog dermatology.
Dr. Lucas, what causes skin problems in dogs?
Oh, that's a big question about what causes skin problems in dogs. Well, the number one big category is allergies. That's going to be a catch-all for flea allergies, seasonal allergies, food allergies. All can cause skin problems in dogs. Then there's a subset of sort of genetic abnormalities that can be bred into dogs. We know certain dog breeds can actually have like zinc deficiency dermatitis, so that's a particular type of a hormonal imbalance. Well, and there's other hormonal diseases that will cause skin issues, like thyroid disease can cause skin problems. Cushing's disease is another hormonal disease causing skin conditions. Let's see, we have autoimmune diseases. So, your immune system just starts to attack some abnormal place in the skin and will present with an immune-mediated disease. Those are some of the big categories that I can think of right now for skin, what can cause your dog to have skin diseases.
Are derm issues painful for dogs?
Yeah, skin diseases can be painful for sure. The skin is the largest organ of the body. We kind of forget that it is, but it is. So diseases that affect the skin can be that traumatize the skin, ulcerate the skin. Tumors that affect the skin can actually be very painful to your dog.
What are some signs and symptoms that my dog may have a skin condition? Like what are they doing that gives it away?
Well, the number one reason that a pet owner would bring their dog in to see us for a skin-related disease would be just scratching or licking themselves. So licking their feet, shaking their head for ear infections, maybe some infections that are seen, redness, pustules, hair loss, itching, and excessive licking are going to get you in to see us more than anything.
Well, what kind of tests do you perform to diagnose skin conditions?
So we have a little barrage of diagnostic tests that we can do on skin. One of the most common that we're going to do is called a skin cytology. So we're either going to take a little swab or maybe a little scraping of the skin with a slide, and or even press a piece of tape up to the skin. We're going to look at that, what's growing on the surface of the skin under the microscope. We can do skin scrapings for mites. We didn't talk about, mites causing skin disease, but they can. So we can scrape into the skin and actually take a skin scraping, and that's another diagnostic test we can do. We love to do cultures, so culture of the skin to see what kind of organism is growing on the skin and also what antibiotics we can use to treat it. We also can do skin biopsies, so take little pieces of skin, send it off to the pathologist to get a diagnosis, especially with immune-mediated skin diseases or tumors of the skin. And then finally, we have, just trying to think, cytologies, scrapings, culture, like we talk about bacterial cultures, but we also have fungal cultures that we can do on the skin to look for fungal organisms that are growing within the skin. So there's a lot of diagnostic tests. And don't forget blood tests too. If your dog has a hormonal imbalance like a thyroid or Cushing disease, we're going to often do some blood work to uncover that underlying disease that's affecting the skin.
What are some common skin problems in the dogs, and how are they treated? And kind of go through the grocery list.
Yeah. So the most common skin disease that your dog is potentially going to suffer from would be allergies. By far the number one category of dog dermatologic diseases that veterinarians see, which is going to usually prevent, I call it with my big five, foot licking, head shaking, face rubbing, belly scratching, and booty scooting. So they don't have to have all five to have allergies, but those are the big five hot zones of dogs for allergies. With flea allergies, they may have some of the big five, but they're going to be itching and scooting around their bottom and really chewing at their thighs and their rump area around the base of their tail. We can have food allergy dermatitis, which sometimes just presents as recurrent ear infections, sometimes foot licking, but just early age, lots of licking and chewing and scratching at their ears. Immune-mediated disorders usually start out as or maybe around their noses, around their lips, around their eyes, sometimes around paw pads, or even just generalized on the skin, and they'll get kind of almost like raised blisters or thick scales or crusts in those areas. Hormonal diseases like thyroid or Cushing's disease, secondary skin infections are more common, and just hair loss. Like they just start to get a thin truncal hair, which is the hair just on the body, not on the head or the legs. They'll just get a thinning of their hair coat, like male pattern baldness is almost of the dog. So we'll look more for maybe a hormone imbalance with those kids. And then that's why you bring them in. They're itching, scratching, or you're noticing hair loss, or there's some crusting or blisters, something's abnormal, or you find a skin tumor that we need to look at.
What if the problem's going treated for skin?
So skin disease, again, largest organ in the body. So if it gets affected with infections, it makes your dog really incredibly uncomfortable. You can tell, especially if they sleep in your bed or they're, around you on the couch while you're watching TV and all they're doing is licking their feet or they're scratching. It can get to the point where they introduce secondary infections. Those infections can really get deep into the skin. It can cause oozing, odor, and just nonstop itch can cause sleeplessness, irritability, aggressive disorders in dogs, and just ruins that bond that you have with your dog, because if they're stinky and itchy and uncomfortable and they're around you, you might not want to be interacting with them as much or have them as close to you because they're a little stinky, and that erodes that human-animal bond. So we want to see your pet, we want to make them feel better so we can get them the relief that they need and also get that relationship that you might be losing with them back.
What's the difference between atopic dermatitis and contact dermatitis?
So atopic dermatitis, we call it atopy, very, very common. It's environmental allergies, or we call them seasonal allergies. They're allergic to something that they're inhaling or coming into contact in the environment, usually grasses, weeds, tree pollens. Inside it might be house dust mites. There's certain like cottons and feathers. So it's just sort of things within the environment that they're allergic to. Probably the most common allergy in people, as well as the seasonal allergy sufferer. You and I get hay fever-like symptoms, stuffy nose, runny eyes. Dogs get itchy skin, itchy feet, itchy faces, itchy bellies. So those are that's atopic dermatitis. Contact dermatitis, pretty darn rare. We don't see it very often, but a contact dermatitis might be something that's incredibly caustic to the skin, which means damaging or irritating, heavy cleaners at high concentrations that your dog walks through, maybe gets onto the surfaces of their skin, causes intense irritation, redness, blistering. We've had dogs that have unfortunately, come into really concentrated, like kennel concentrated ingredients and have had irritability on their skin. It's super rare, but it's coming into contact with something that's incredibly irritating to the skin. That's a contact dermatitis.
And is there curable versus incurable skin problems in dogs?
Yeah, so a curable skin condition that would be probably seen a lot during the summertime would be flea allergy dermatitis. So dog gets fleas, gets bit by fleas, causes an intense allergic reaction to the fleas, gets really itchy, gets secondary infections, can come in looking like a hot mess. And we can give that dog some relief through medications, good flea control, completely curable. You think we look great, dog feels awesome, curable. Unfortunately, a lot of skin conditions in dogs, sort of like allergies, so those aren't usually curable. Unfortunately, they're often going to get maybe more intense as they grow into their allergies over time. We will see dogs usually presenting with skin allergies or seasonal allergies, usually between the ages of 1 and 3. That's the most common age group to come in with their first allergic symptoms, ear infections, itchy feet, and then they just kind of get worse as they get older. Immune-mediated diseases, we can treat or manage those, usually not curable, but long-term management is really good. Skin tumors, we didn't talk a whole lot about skin tumors, but skin tumors are a pretty common part of dog dermatology. Those can be curable, especially if we just excise them or remove them. And then mites, fungal diseases, skin infections, all, if we get them diagnosed correctly, those are all curable diseases oftentimes. So dog dermatology, big topic, lots to talk about. So if you feel your dog is suffering from anything going on in its skin and you just want to have it looked at and talk to your veterinarian, we'd love to see you here at Blue Oasis Pet Hospital. Thanks so much.